97.9, 105.5, KISS FM. It is Liz, and I am joined today with Slocum Dickson Medical Group. It's the Slocum Dickson Medical Moment. We do it every first Wednesday of the month. And in studio, Adrian, how are you doing?
I'm good. How are you?
I am doing... I gotta tell you, I could be doing better.
Really?
I have a double ear infection now.
Well, this is appropriate then.
I know, it really is, because I have some questions. Can you introduce who you brought with you today?
Yeah, so with me today I have Dr. Visalli, who's one of our new primary care physicians, and so we're really happy to have him. He's local, grew up here, and he's back, and he's helping our patients.
I love it. Good morning, how are you?
Good morning. Thank you for having me here. I'm doing very well.
So you are local, you went to Notre Dame High School, went to Utica College, I heard.
Yes, that's correct. Grew up in Utica.
Very, very fun. So did I. So, and the best part is I do go to Slocum Dickson, so I had to go to urgent care to go check out this ear thing going on because I tried to ignore it. I tried to self-diagnose it, and to the point where it started to hurt. So you do primary care, you do internal medicine and pediatrics, correct? Am I
That's
right
correct,
on that?
yes. I'm board certified in both specialties.
Very, very cool. So when it comes to cold and flu, what's the differences? What are we looking for? What can you tell people like me who are going to try to ignore it? What's up with that, especially this time of year?
Well, in actuality, you kind of did the right thing. I mean, for the most part, most common colds are going to be that icky feeling you get in your throat hurts, you have drainage in your nose, you have nasal pressure, your ears can hurt actually with a common cold as well.
Oh, okay.
The difference between that and the flu is really much more the severity of things. So you can get similar symptoms, but influenza is much worse, and usually accompanies with a high fever.
Oh, yeah, okay.
Unfortunately, with a common cold, there's not a whole lot you can do about it. Symptomatic therapy, things like that with Advil, Tylenol. But if you actually look at the studies of what helps to reduce the length of a cold, not really anything.
Really?
It's really unfortunate because we get a lot of people coming in saying, oh, I feel terrible, I have a cold, maybe I have the flu. We do test you for the flu and then it's negative, so what do we do next?
Yeah.
And the answer is that colds can sometimes last for up to 7 days. And even worse than that, people get this cough afterwards that can last for 3 to 4 weeks.
So that's normal then, because a lot of people, it kind of makes me nervous when I can see my coworkers going through it, and I'm like, oh, you guys, you've been sick for far too long. It's something much worse than just a cold, but that's not the case.
That's not the case, especially if you're not having fevers and you're not having shaking chills all the time. If it's just that you have the congestion type symptoms, and those can last, like I said, for about 7 days, sometimes even a little bit longer, but the cough can linger for weeks.
Oh my gosh. Okay, well, STMG.com to get all of the details, whether it's about the urgent care, which we're fantastic, by the way, and also just to get more details on people who are accepting patients. I do have a question for you, because with your name, there is a D-O after it.
Yes.
And that's different than the M-D I'm used to seeing. What exactly is the difference between that?
Well, I think many years ago, there was a bigger difference.
Oh, okay.
Nowadays, it's actually pretty similar in the fact that our training is almost exactly the same. One of the major differences between a DO and an MD, and MD is the more classic that people know about, is that DOs actually are trained in manipulation as well. So we have kind of I don't want to call it chiropractic type nature, but we have more experience with physical therapy type modalities and chiropractic type things as well. Now, I myself really don't practice that as much because I was in the hospital working as a hospitalist for some time.
Okay.
And kind of don't have those skills as much as I used to, but
Gotcha.
Some of my fellow colleagues do that still.
Okay, because I was just interested, because, I do radio for a living, and I don't get one of those fun things added to my name. It's just, it's just Liz. It's just Liz everywhere, SDMG.com on Facebook and Twitter. Make sure you're checking them out. And Adrian, with the role of primary care physicians, you guys have people who are accepting patients, correct?
Right. Dr. Visalli is one of them. So if you're looking for a primary care physician, check out our website. Look him up. His number is 798-1830 if you're looking. And we always kind of push this idea of having a primary care. Like you talk about urgent care, which is great in those certain circumstances.
Right.
But really, when you go there, I'm sure they said follow up with your primary.
Yeah, they did.
And if you don't have one, that becomes an issue. So I think it's really important just for your overall health, those regular checkups, some of the screenings that they can do to catch things early before you end up with big time problems. And then when you have things like infections that come up, it's much easier to, make an appointment, make a phone call, follow up with your regular doctor.
For sure. So if you want to get in with Slocum Dickson Medical Group, they do a fantastic job. Everything is right there. They can help you. SDMG.com. Thank you so much for coming in and explaining to me the difference between a cold and a flu. I appreciate it. And until next month, the Slocum Dickson Medical Moment every first Wednesday of the month right here on KISS FM.